Hello and welcome to this short talk about how much exercise we should be aiming to do, what types of exercise are recommended and why exercise is beneficial. We include exercise as part of all of our programmes as it's been shown to be the best treatment we have for musculoskeletal conditions, that is, conditions involving the bone, muscles, nerves and joints. Rather than there being one perfect type of exercise to manage these conditions, research suggests that the most important thing is to increase the total amount of time you spend every week being active. In particular, doing moderate or vigorous intensity exercise.
How do we know what this means? How intense an exercise is depends on lots of things. As a rough guide, during moderate intensity exercise, your heart rate will be noticeably raised. You might be sweating or would find it difficult to hold a conversation at the same time. Examples might include cycling, fast walking, gardening, or hoovering. In vigorous intensity exercise, your heart would beat significantly faster. You would feel short of breath and might want to change your clothes after. This might include running, doing an aerobics class, carrying heavy objects, or playing football. How intense you find these exercises will depend on your fitness levels. What's important is not the exact type of exercise you're doing, but how hard you're working when you're doing it. The World Health Organization recommends that all adults do at least 150 minutes of moderate intensity exercise every week, or 75 minutes of vigorous exercise. You could do this in short daily sessions of 20 minutes, or longer sessions every 2 to 3 days, for example, for an hour. At least twice a week, you should include resistance exercise, meaning you work your main muscle groups to the point of fatigue. This might include using free weights or resistance bands, or bodyweight exercises such as step-ups or press-ups. It is doing these types of physical activity that will lead to noticeable improvements in your cardiovascular fitness, bone and muscle strength, sleep, and mental health. If you are in pain, it can be harder to be physically active, and unfortunately there are health risks associated with a sedentary lifestyle. This means it's even more important to be conscious of your physical activity levels if you live with persistent pain. The good news is that there is evidence that exercise can decrease overall pain levels in a variety of conditions such as chronic back pain and osteoarthritis. You will also be at lower risk of developing conditions such as type 2 diabetes, cardiovascular disease, falls, depression, and cancers if you lead an active lifestyle. Because exercise can help so many different aspects of your physical and mental health, we recommend everybody does it, not just people who already have health problems. If you would like to learn more about the benefits of exercise, please see the links in this video description to see our recommendations for videos to watch. We've also linked to some exercise videos to help you get started, and you can find videos and other resources on the NHS Fitness Studios website. Thank you for listening and good luck.